You get aroused, everything starts off fine, but then, just when it matters most, the erection fades. Sound familiar? You're not alone. Thousands of men experience this sudden, confusing loss of firmness mid-act. And while it can feel alarming, there are clear reasons behind it and solutions. In this video, we'll uncover 3 of the most common causes. We'll explore what's really happening inside your body and mind, and what steps you can take to regain control and confidence where it counts most. Before we dive in, make sure to hit the subscribe button, like, and share this video, because this is information every man should know. By the end of this video, you'll have a stronger understanding of your own physiology. More importantly, you'll know what steps you can take to improve things going forward. To understand why an erection might fade, we first need to understand how it happens in the first place. An erection isn't simply about arousal, it's the product of a highly coordinated interaction between the brain, nerves, hormones, and blood vessels. It all begins with sexual stimulation. Signals travel from your brain through the spinal cord to the pelvic nerves. These signals prompt the release of a chemical called nitric oxide. Nitric oxide serves as a potent vasodilator. It relaxes the smooth muscle walls of arteries, especially the cavernosal arteries within the penis. This relaxation allows a greater volume of blood to flow into the corpora cavernosa, the 2 sponge-like chambers inside the penis. As these chambers fill, internal pressure rises, causing the tunica albuginea, the firm outer layer, to expand. This expansion compresses the veins that normally allow blood to drain away, effectively trapping blood within the penis and maintaining firmness. It's a delicate and highly coordinated process. If any part of this chain is disrupted, whether through physical, chemical, or psychological factors, the result can be a sudden loss of rigidity. One of the most frequently overlooked reasons for losing an erection mid-act is cardiovascular health. That's because achieving and sustaining an erection depends heavily on proper blood flow. And the blood vessels involved are remarkably small and sensitive. For example, the cavernosal artery in the penis measures roughly 0.4 millimeters in diameter, much narrower than the coronary arteries supplying the heart, which typically range from 0.8 to 1 millimeter. As a result, any condition impairing circulation, including high blood pressure, elevated cholesterol, smoking, diabetes, or simply aging, can interfere with your ability to maintain an erection. In fact, erectile difficulties are sometimes one of the first signs of broader vascular issues. When arteries become narrowed or lose flexibility, the volume of blood reaching the penis is reduced. An erection may begin strong, but without adequate ongoing blood flow, it simply cannot be sustained. It's not just about heart health, it's about the entire circulatory system. And when penile blood vessels are affected, it often signals that other parts of the body may also be under strain. Another potential cause of losing an erection during sex involves the tunica albuginea, the tough, fibrous layer surrounding the corpora cavernosa. This structure plays a critical role. As blood fills the penis, the tunica albuginea expands, compressing veins that would otherwise allow blood to escape. This compression traps blood inside, maintaining a firm erection. But when the tunica albuginea loses elasticity, often due to chronic conditions like diabetes, it may no longer provide sufficient pressure. As a result, blood can begin leaking out prematurely, even though arousal remains. This condition is known as venous leak, and it's one of the more frustrating causes because at first, everything can appear to be working perfectly, until it suddenly doesn't. For an erection to hold, the tunica albuginea must remain both strong and flexible, so it can maintain the needed pressure. But when this layer becomes stiff or thinned, its ability to sustain an erection declines sharply. This problem is particularly common in men dealing with poorly managed diabetes, which gradually damages tissue and weakens function over time. Now, even when everything is working correctly on a physical level, your mental state can strongly influence whether you maintain an erection. Stress, anxiety, and performance pressure. These emotional factors can spark the release of adrenaline, a hormone designed to prepare your body for fight or flight. While this response is helpful in life-threatening situations, it's exactly the opposite of what your body needs during sex. Adrenaline acts as a vasoconstrictor. It tightens blood vessels and limits blood flow, including to the penis. That means even if you're highly aroused and achieve an initial erection, elevated stress levels can physically shut the process down. This effect is particularly common in younger men or those in new relationships, where performance anxiety and the desire to impress can run high. Your brain plays a central role in sexual function. When your thoughts become consumed with worries about your body, your partner, or the moment itself, these concerns can block the very signals that keep the erection going. The result isn't a lack of desire, it's a physical reaction driven by psychological tension. Here's the good news. In most cases, there are clear, actionable steps you can take to address these issues. Let's begin with cardiovascular health. If restricted blood flow is part of the problem, improving your circulation is a crucial first step. This means managing conditions such as high blood pressure or diabetes, quitting smoking, reducing excess weight, and building a habit of regular exercise. In many situations, medications like Cialis or Viagra can also provide significant help by enhancing blood flow, but they're most effective when you're also tackling underlying health concerns. When it comes to tunica albuginea issues, especially in men managing diabetes, the primary focus should be on maintaining tight blood sugar control. Keeping glucose levels stable can help protect the delicate penile tissues from further damage. In more advanced cases, medical treatments are available, including penile injections or intraurethral gels, that can help sustain an erection even when venous leak is a factor. If the root cause is more psychological, therapy can be extremely effective. Working with a qualified sex therapist or psychologist can help reduce performance anxiety and interrupt the cycle of stress-driven erectile problems. In fact, sometimes just knowing that you're not alone and that this is treatable can make a world of difference. Experiencing a loss of erection during sex can certainly feel discouraging, but it's crucial to remember this does not define your masculinity, nor does it diminish your worth. In most cases, it's not an unsolvable mystery, it's a signal from your body. Whether the issue stems from your cardiovascular system, your hormones, your stress levels, or your overall lifestyle, your body is trying to tell you something. And the sooner you begin to listen, the sooner you can reclaim control and make progress. Knowledge is power. And understanding what's happening is the first and most important step toward improvement. You do not have to face this challenge alone, and you certainly don't have to settle for frustration or uncertainty. Talk to your doctor, explore your available options, and don't hesitate to seek support, whether you need physical solutions, emotional guidance, or both. If you found this video helpful in any way, please consider giving it a like, subscribing to the channel, and turning on the notification bell so you don't miss future content. And if you feel comfortable, share your own thoughts or experiences in the comments below. We read every comment, and you never know who you might help just by speaking up.